I think that back pain affects all qualities of life.
I would be, I'm sure, very irritable and not much fun to be around.
My back pain keeps me from doing things that I normally do.
I was actually training for a marathon.
Overall, it keeps me kind of slowed down.
Used to be able to run, 25, 26 miles, and it was reduced down to maybe 3.
I would have to take too many over-the-counter medications.
It gets to the point where sometimes it's a shooting pain.
A constant ache
down the back of my leg and a lot of discomfort.
Causes headaches, and I have difficulty turning my neck.
It's just always there, and there's always an underlayment of pain that rises and comes back daily.
Frustrated with back pain? Feeling like you're enduring life rather than enjoying it? Well, you're not alone. More than 65 million Americans will experience back problems this year. Only the common cold causes more people to miss work. And you're not alone if you've spent hundreds or even thousands of dollars on treatments and medication. This year alone, Americans will spend more than $50 billion treating back and neck-related pain, many times only experiencing temporary relief. What if you could finally get more permanent relief? What if there was an alternative to medication, painful exercises, bed rests, and surgery? What if you could finally enjoy your life again? The great news is, you can. How? With DTS spinal decompression therapy, a leading non-surgical alternative for disc-related syndromes of the lumbar and cervical spine. This comprehensive treatment has already proven effective for back pain sufferers around the world. In fact, many patients feel relief after their very first therapy session, and some 7 out of 10 patients who complete their treatments walk away with their back pain totally eliminated. So you're not alone in your back pain, and now you're not alone in starting this exciting new therapy. You're joining thousands of people who are experiencing back pain relief thanks to DTS spinal decompression therapy, the safe, comfortable, and long-term solution to your back pain.
Every time I come out the DTS table, I do feel much better.
I think it can have a great impact on a lot of people's lives, just like it has on mine.
There is a therapy that can help those problems in their neck without surgery, without drugs, that's safe, and it works.
You can feel confident knowing that the developer of this revolutionary decompressive treatment is the world leader in physical therapy equipment design, with over 8,000 systems installed worldwide. Although DTS systems have primarily been used in hospitals, now, through advancements in manufacturing technology, DTS therapy is also available in many clinics and private practices. In many cases, back pain is the result of an accident or injury. In others, pain has resulted from day-to-day stress and simply develops over time.
I always attribute it to just getting older. One of the things that I assumed everyone went through. And then when I realized that it's actually a compression problem in my neck, that I don't have to feel like that.
In order to understand what makes DTS spinal decompression therapy so effective, it is important to first understand the structure of the spine and the discs of the back. In the simplest terms, over the years, the spinal discs of your back and neck take the brunt of the compressive forces of gravity and stress. Small, minute tears in the outer structures create weakness in the discs. When stresses due to movements or an injury increase the disc pressures, a failure of the shock-absorbing qualities of the disc cause pain and muscle spasm. Although muscle spasm is the body's way of dealing with instability of the spine, it causes excruciating pain.
I could not even stand up straight, or even I had a hunch over. I couldn't move to sleep, period.
There were days where I would almost be in tears. My back hurt so bad.
DTS is a comprehensive treatment plan which uniquely addresses your back pain through 3 phases of therapy. Typically, the sessions last less than 20 minutes, and, unlike other alternatives, your comfort and safety are of primary importance. In fact, in order for DTS therapy to achieve the ultimate objective of complete rehabilitation, you must be 100% comfortable.
It's wonderful. It doesn't hurt. In fact, at one time I fell asleep while I was having the DTS therapy.
Let's get started. Decompression therapy is delivered utilizing the table, traction motor, and a specially designed belting system. Our trained staff will place you in a custom-designed harness while fully clothed and adjust the harness to fit your body size and shape. Again, at no time should the treatment be uncomfortable or painful. Once the computer traction device is set, the treatment begins with a very gentle progression towards a decompressive or what might feel like an anti-gravity state for your spine. While you're lying in a relaxed and comfortable position, the DTS system does the work, stretching and distracting the spinal column, creating a vacuum effect that decompresses the discs within the column. This vacuum can, in many cases, help retract or draw in the herniated disc that may be pinching a nerve. Most patients report this as a comfortable, stretching sensation.
It feels like a very gentle tug, almost like what it would feel like if I were hanging upside down and stretching out my neck just from the weight of my head.
The first phase of the treatment should give you dramatic reduction of your painful symptoms.
When I was done, I got the table. I was like, wow, that feels really great. My back was really loose, and I mean, it just felt great all the way from here down, which normally is pretty tight.
I haven't had a pinched nerve since I started this.
The primary goal is to get you as pain-free as possible, and then introduce much-needed mobility to your spinal column. The decompressive portion of the DTS therapy system creates negative pressures, or a non-compressive state, to the discs, helping to bring blood supply and nutrients to the discs to begin the healing process. Our initial goal is to restore the body's own healing mechanisms that are temporarily lost during the acute phase of injury. Placing your spine in a decompressive state will help take the pressure off the nerves that are causing you pain. The treatments last anywhere from 15 to 20 minutes. Your technician will then let you rest quietly and will return at the completion of the therapy session. If you are uncomfortable for any reason, you have the ability to immediately stop the treatments with a press of a button. When your doctor feels your spinal discs and the muscles that support them are stable enough to start the biofeedback-based core exercise and strengthening program, you will proceed to the next phase of DTS therapy. Fortunately, your painful symptoms may be substantially reduced by this point, but the structures supporting the spine are still in need of repair and retraining. And again, this is crucial for long-term recovery. And that is why it is necessary to continue with the exercise and stabilization portion of the DTS spinal decompression therapy.
On an ongoing basis, as I repeat the therapy, my neck will actually get stronger and the problem might correct itself without any other treatment.
From this point forward and leading into phase 3, you will be performing the exercises in our clinic and at your home. Continued blood supply, enhanced by decompression of the discs, is ultimately what promotes healing to the damaged structures of the spine. Remember, this is a treatment plan with the goal of long-term recovery. Even though the pain you originally felt may finally be gone, that is not an indicator that you are fully healed. The damage may go much deeper, and the process of healing your back takes time. Therefore, you'll need to continue your home-based exercises daily for a length of time. Restoring you to the lifestyle you've been missing is our goal. Utilizing the most current technology in decompressive therapy and focused rehabilitation is the foundation of DTS spinal decompression therapy. Together, we hope to return you to the function and lifestyle you desire. This is our highest priority.
It is wonderful to have an option like DTS therapy that allows me hope that my problems in my neck will continue to get better, not worse.
I am very grateful for the DTS system.
The pain has been relieved, and I can live a better life.
The DTS therapy system and our highly trained staff, together with your hard work and determination, is the best solution available to substantially improve your condition and live the life you want to live.